All right, now for this weekend social story, that's where we post 3 stories on our social media and you at home decide which ones we take a closer look at. So this week's choices: the CDC changing its hepatitis B vaccine recommendation for newborn babies, World Cup tickets, or the event in Phoenix this weekend from the creator of Fire Festival. So with 53% of the vote, you chose a panel of CDC advisors voting to end the long-standing recommendation that all newborns get the hepatitis B vaccine. So for more, let's bring in former CDC Director Tom Frieden. He served under the Obama administration, now works as the founder and CEO of Resolve to Save Lives. It's a global health organization. So, Doctor, why do you think they made this change?
Well, I can't really say why they did it. What I can say is that it's a big mistake. This is a strategy that has resulted in the dramatic reduction in the risk of a serious and sometimes deadly infection. And if followed, this change in recommendations would endanger a generation of American children. The hepatitis B virus is quite serious, especially if infection is in if infection is in infancy, with up to a quarter of infected infants developing severe long-term complications, including cirrhosis, liver cancer, and death. The vaccine is safe and effective, so there's no good reason to change this. They're messing with success and they're endangering our children.
Does this change anything for parents who still want their babies vaccinated against hepatitis B?
It may make it more complicated, but I think what we're seeing is that obstetricians, pediatricians, medical societies, and insurers are all saying this is not evidence-based recommendation. This is not really something that is valid, and so we're going to ignore it and stick with the recommendations that have worked so well for the last decades.
You know, there's been a lot of questioning and distrust with the public health right now. How can the medical community do more to instill trust, specifically in vaccines?
I think this is a real problem because what we now have are people who have made a lot of money suing the vaccine companies, presenting as if they are the CDC. We've had essentially a takeover of the CDC by anti-vaccine activists who are really subjecting us to a fire hood of falsehoods. And this makes it really challenging to have clear communication. It is important that we listen to all concerns that parents and other patients have and to answer them with clear facts. The hepatitis B vaccine is safe and effective. Hepatitis B infection can be very serious, and universal dose vaccination has been very effective at reducing the risk.
I'm looking over your right shoulder. You wrote a book called The Formula for Better Health. What are your big 3 takeaways, let's say, to improve public health?
It is possible to improve health by seeing the threats that occur, by believing we can make positive change like eliminating hepatitis B, and by creating a healthier future, by overcoming the barriers, whether they are financial or access or otherwise. Because really we have better tools than ever in human history to live a long and healthy life. And if we follow the facts, we can do just that.
Dr. Frieden, thank you. We appreciate it.
Thank you.